and then she's gonna come out here and go over the prep of the station, and then we will pre-med the dog. Okay, we're all in.
All right. So the idea of this room is to get it ready so that we can bring the first dog in and hook them up immediately, and have it ready and set for the day. So first things first is the oxygen. So this is the only tank you're going to be turning on. Do not turn that tank on, okay? Just the big guy, okay? Quarter turn just like the rest of them. It makes a fun noise. You know it's on, okay? So this tank only. We have the anesthetic machine, so this is how not to leave the machine at the end of the day. Nothing's wound up, everything's a mess. If I were to come in here with a dog, I mean, we always put an example of what if it's an emergency. Am I gonna be able to get this stuff unwound and on my patient fast? No. Okay, so at the end of the day, like this over here, we want everything kind of wound around their own little section. Okay, we want it nice and neat. It only saves you guys time for the next week as long as everything's put away nicely. Okay, so let's see here. So we have our temperature probe. So this is esophageal, or not esophageal. Oh yes, esophageal. Only. We know what kind of parasites these animals have. So we only feed it down the esophagus, right next to your esophageal stethoscope. Okay? So this stays nice and clean. I'll just put it there for you. You guys are relatively familiar with this machine, right? You guys use dentals last quarter. So we just want it kind of all set up. We want this guy, so our EKG, we want it set up to how they're going to be laying. So just remember they're going to be on their backs. So our right side is going to be on the outside. When you're clipping these on, they don't have like super grippy teeth, but make sure it makes it on the red guy or the blue guy, okay? These Puggyvacs are very expensive and they tear and break very, very easily. So just put it on fabric and not that guy. I have black over here. Red down here, okay? We have our blood pressure cuff, and we all remember how to measure for blood pressure cuffs, yes?
Yes.
What is it?
The leg, you hold it to whatever limb you're using, and it's got to cover 50%?
40%. 40%. Very, very close. So we want 40%. This, we have essentially like 4 sizes. We have small, which is in here. They all kind of stay connected to their cords. We have kind of a medium large, and then we have like, there's like a super large, and then we have like this extra large. So 9 times out of 10, we're gonna be one of these two, but we still measure, right? For these. These are not to be taken apart typically. They're very, I don't know. But these pieces break pretty easily, so like the little connector pieces that go together. So we have 2 cords that you'll just disconnect from the machine. Okay? So this is going to be kind of front leg or back leg, most likely front leg opposite of the IV catheter. We have our SpO2 guy. So this guy is going to go on a tongue, between a webbing of a paw pad, something up towards the head so that we're not in doctor's way. So this is going to be hooked up around here. So we're going to kind of put it in a general area that we want it to be. We have our ETCO2 here. Once you get done, I haven't pressure checked my machine, but once you get done pressure checking, we'll put this on your anesthetic machine. Everybody here should know how to put together an anesthetic machine, rebreather, non-rebreather. Yes.
You show them how to room air
No.
You're gonna do that later when it's.
I'll do that after I get done putting it on. But non-rebreather, rebreather. This machine in here is different from that machine. It's opposite. Like these two are flipped, so just be aware of that. Okay. This is a safety machine, so this is has a kind of a special way of pressure checking. You have to close your pop-off valve and you have to hold the quick button down as well. So I usually hold it with my thumb, hold it with like my palm or my arm, and that's when I use my other hand to use my quick flush valve. I'm gonna go to my 20 just per the use. I'm gonna squeeze and hold. It holds pressure. I'm gonna release. Before I take my thumb off, I always open up the pop-off valve. It was one of my instructor's way of reminding me to always open up the pop-off valve before I put my finger off. It's something that I've always done, probably always will, because I'm terrified of leaving the pop-off valve closed. I urge you guys to practice the same measures because it's a very scary thing, okay? Generally one of us will catch it if something does happen. Accidents do happen. That's why there's so many of us to watch you guys. But I will put my ETCO2 guy on here. I already turned my machine on. It's just this big yellow button. I don't like when this beeps. We all have our little ticks. So I always pause it. But when you first bring everything up, you guys are pretty familiar. Do you guys want me to go through this really fast? Yeah? Okay. So our top number is going to be our EKG reading. So this is going to be our heart rate. Okay, so once we hook up all of our leads and alcohol them, we should get to have a nice reading on here. It'll give us a number here. We have our pulse ox here. So this is going to be our guy that we're going to put on our tongue, or a mucus membrane of some variety. The big blue number is going to be our percentage. It will give us a heart rate down here as well to kind of coincide with your EKG. We'll have our ETCO2, so that's the guy we put on the end of our tubing here. That'll be in our blue. Over here in the white will be our temperature. So that's going to be our temperature probe that we're going to feed next to our esophageal. And then make sure you guys study kind of your ETCO2 like waveforms. So that's pretty important to kind of monitor throughout surgery as well. We should have a nice waveform with that. And then we have our blood pressure. So in yellow here is going to be our blood pressure. It's going to read systolic, diastolic, and mean. Okay. This is an auto machine, so it will take a reading every 5 minutes, but on occasion it won't take a reading. It'll be a false reading. It won't read. It'll say too much movement, things like that. There's two ways of starting it again. We have our start stop here on the screen, or there's a start stop actual button. So if you get a one-off reading, it's super high or super low, and you're like, I don't know, just push it. I'm not really mad at it. Like, you're checking your numbers. I appreciate that. Okay, so just note that those are aware, and then it'll reset your clock for 5 minutes. So you might have to kind of reset it when you take your actual reading for your readings here. Okay. We have our canine up here. So this is where we change our canine to feline. Okay. So you'll just click the name. Obviously, we're not doing swine or cowbine or bovine or equine. So you have two options. It's a 50-50 shot, right? So our first search is going to be canine. You don't necessarily have to select male or female. It doesn't really matter as far as our parameters go. It's just so happens to be a male. Save your work. It'll come back. It should change that. You also have to calibrate your ETCO2. So that is just your ETCO2 area. You're going to click it. Over here in the top right corner is going to be 0 setup. Okay, click that. We are on room air. We don't have any fancy equipment in here, so we're just going to start zeroing. It's going to be everything started. It'll do its thing. We're going to hit back again, and that's taken care of. Okay, we tried to fuddle around with this last quarter with doing it in between surgeries, and then it ended up not reading. So we'll kind of play it by ear with how it's going to work. But definitely, whoever's setting up in the beginning of the day, we're going to zero it out. Okay? Any questions on this guy? No? Okay. Everything's kind of labeled. Obviously, I will be in here. I'll be opposite of you, checking everything, pushing buttons, getting on your nerves. So we have that. Again, I hate this beeping, so always pause it in between patients. Do not turn it off because it takes so long to boot back up. We just want to pause it.
Well, weren't you having issues with it resetting every time it got turned off and turned back on?
Yes, yeah. So theoretically, it should stay the same because all we changed was canine to feline, but we never know. Same with, I forgot to mention, with oxygen for the day. Once this guy is turned on, it stays on for the day until we're done with the last surgery and we're cleaning up. Same with those two machines out there. Again, just in case of emergency, we say it over and over again until it happens. You know, we pray that it doesn't happen. We want it on. Our first line of defense is always oxygenate, right, for our patients. So we have that. We have this. We have this. Our table here. There is 2 levers. So this lever that's on this side tilts our table. So when we loosen it, it tilts. The lever on that side twists our table, and then it makes it so that we can lower and raise it. So depending on the size of the dog, I do have a measurement on there somewhere in Sharpie. Doctor and my height are pretty much the same, so it's...
So your side is tilt and this side is rotate?
Correct. Okay. Rotate and raise. Okay. You okay?
Yeah. I was just checking the hole.
Oh,
Usually
yeah.
you want
So that the hole and it drains down that way.
and it drains down that way.
So just in case someone aspirates, we need to find a part of some variety. We can tilt it. It's not super often that we have to. It doesn't stay tilted. So if you tilt it and then go to loosen it, it will slam down. So make sure you have a good hold on it. We have our bed jet here. So this table, first off, will be your Huggy Vac. So you're gonna pick the size for the largest patient for the day. So we only have one patient today, so we picked large because he's a larger guy. There's multiple out there. A couple of them are broken. They do say broken on them, so don't use the broken ones. So this guy is to position, okay? This is the most expensive part on the piece of equipment. This is to inflate and deflate it. So the pump rubber guy is over here. Oh boy. So do not get, as one would call it, rammy. Gentle touches with this because, again, it's very expensive. So gently put it on. You don't have to like shove it on. When your patient, this weird looking creature here, is in your trough, when you position them, you're going to kind of roll the sides in. You're going to hold it kind of with your arm. So your patient's going to be in here. You're going to kind of engulf them. So this makes sure that they don't like rotate side to side. You're going to hit it with this. And then once you have everything kind of positioned to where you want it, you're going to kind of use your body here. And you're going to pump. So this is a 2-way pump. So once you're positioned, you're going to pump. As you can see, it's filling up. Obviously, your patient's not going to be this small. But you're going to kind of roll it. You don't want it to be super high on the sides. It's easier to say when there's a patient in here. But the sides will be kind of folded over so the doctor doesn't have to like climb over a hill to get to the patient. Okay? So once you're inflated to your liking, you are going to lock this into place. So you're going to push this metal clamp down. It's going to create that gap there that you see. Your safety is going to go in there. You're going to hold this white piece. You're going to hold your rubber piece. And you're just going to gently kind of tilt off. And then it'll stay. Okay, so this will hold your position for your patient during surgery. Once you're done with surgery, this clamp comes off. And this piece goes in. And then it'll reinflate. And then just kind of reposition, once the patient's out of here, you kind of reposition the beads for the next patient to come in. Next is going to be your BedJet blanket, I guess. The words, there's like words embroidered on it. Those go up. If you have the words on the bottom, the hot air blows down, not onto your patient. They all live down in that cabinet. These can be washed, but they cannot be dried. Do not put these in the dryer, it will ruin it. Okay? There's like 3 or 4 different sizes. There's like a small, medium, large, extra large. We can always, like I said, this will be kind of for your largest patient. We can always
Small, medium, large.
fold it for the smaller patients that come in. On top of it will be a drape. You don't need a large drape, you just need enough drape to go over top of it. This is so that we can reuse this for every patient. Now if it gets soiled for some reason, we can obviously switch it out. But the point of the drape is so that we don't have to change it every time. It's faster turnover rate for our patients. I don't know, we're probably gonna be doing 2 to 3 patients, 2 patients.
Plus cat litters.
So we'll want to reuse things. These can always, we can flip them between patients as long as they're not like super gross. Okay. Turning on BedJet is a button on the left. This is another thing that'll be turned on at the beginning of the day and just keep it on for all the patients. Once that light is on, you're golden. We're kind of entering into cold months, so we'll want to preheat this room like a banana bread. Some days like today it's kind of hot in here, so we probably won't. But the top button on the remote is going to inflate your bed here. Okay? So this is going to keep our patient nice and warm from the bottom. We have towels over in the corner to put on top with a warmie to keep things on top. When you get done, if you don't want it on, you just push the button again. And then it'll turn it off, but it'll keep the machine on. Good? Okay. We have our esophageal stethoscope. We want the largest probe appropriate for your patient. Most cats will get a medium. I only use the super small guys. So like these guys, I think I've only used in like a kitten. It's harder to hear. You want the best, in the most surface area to hear the heart. Okay? So these guys probably will be using, we don't really do too many kittens. The dog today will get a large. So this guy, these will get cleaned in here. They do not leave the surgery room. If they get submerged, then they're garbage. Water gets in here and then it can't come out and it molds. Okay, so do not put these in the sinks. It just gets cleaned in here and then put back up. Okay, I would recommend using the stethoscope with the rubber on it and not the ones with the hard plastic. These suck. I'm not gonna have Daisy chain around it here, but they do hurt your ears. Okay, I know, I do it. You guys will do it, it'll be fine. Okay. Before we feed this down a patient, you're just gonna put a spot of lube on the tip of it, just to help it slide down. And then we'll use that lube to slide the temperature probe down.
Which means that lube is never to be used for a thermometer unless it is put onto a gauze square.
Okay. Good. Questions? No? All this stuff up here is Sarah's stuff, so if you take it, replace it. Please. Yes. Alright. I'll throw that there because we need it today. So we have that. We have this. We have that. This will have our scrub on it to begin. Our pack will be in the window. Have a couple packs of 2-aught and 3-aught suture in the window. We can always get more, but have a couple to start. I think most of the doctors here use 15 blades. There is 10 blades just in cases. Glue, tattoo ink in the window there. That. Over in the corner, I like to keep a couple extra towels. One for the patient, one for if we're super messy when we're scrubbing. The can liners are down below the suction there. So the little clear guys, they go in your bucket. A little kick bucket here. There's extra things in that pull-out drawer, so extra tubes just in case these. We have our crash kit, so become familiar with our crash kit. We want you guys to know kind of where all of our emergency drugs are. When an emergency comes, like Sarah said, there's a lot of stuff that happens. Sarah and or I will be barking orders at you guys to go grab us something, to do something, to get something. And we just want you guys to be very familiar where everything is at, just in case we need you guys to grab something, okay? We don't expect you guys to run an emergency, but help in it, okay? So we have that. And now the Heska pump, okay? So this is something that you need to know, period. So practice it, please, okay? So it doesn't have a lot of buttons, but she can be a little tricky, okay? But this is a very, very common pump that's out in practice. We don't keep her plugged in. When it yells at us about the battery, we'll plug her in, and then we want her to stay as crisp and save her battery as much as possible, okay? So when we look at our Heska pump, these buttons that are kind of split in half, this is not 2 buttons, this is 1 button. So you don't have to dig your nail into one side of the button, please, okay? So when you turn it on, you can kind of visualize kind of how everything works. We have our rate over here, so this is going to be in mils per hour, so it's labeled here for you. The rate you'll be using is going to be your surgery rate, unless otherwise told to, okay? So this will be kind of how we monitor our fluids here in surgery, okay? So we have our rate. We're going to use our select button. Time will calculate itself. So time, this is how long it's going to take the pump to infuse what we tell it to infuse, okay? So this will calculate itself. You don't do anything to it. VTBI is going to be volume to be infused. So this is what we are going to put into our patients if we were to enter everything that we want to, if our surgery goes the period it says it will. So this will be our overdose. So we will not be going over that number. So that is the volume to be maxed out, the volume to be infused potentially. VI will be volume infused. So this is what will be 0 to start because we haven't infused anything. So this is what we will be putting into our patient, or what has been put into our patient, what has passed through this machine, okay? Over on this side, we have macro and micro, and then we have 2 other things that we're not gonna worry about, okay? So the only thing that you're gonna need to know in this class is macro and micro. Now, how do we tell a macro set from a micro set? Does anybody know?
You just want the difference between them?
I just want, if me, Joe Schmo, I didn't calculate nothing, I'm gonna look at that bag that we're using today. How do I tell, just on first glance, if it's a macro or a micro?
Would it be based on the size of the liter of reservoir bag?
No.
Because I know it's kilograms.
It's nothing to do with calculation.
Okay.
I have no calculator on me.
Okay.
I'm gonna look at that bag. I'll bring it out for example. It's gonna be yellow. So I'm looking at this bag right here.
Oh, okay.
How do I tell from where you're standing if this is a macro or a micro?
The little thing that would have dripped.
Yeah. So this little guy here, so your drip set is this guy's a macro because it doesn't have. There's usually a little needle that goes. Let me just show you. And I'm gonna shut this off because this is another tick.
Yeah, can you just,
It's a micro. So this has a little micro drop on it. Now it could be metal, it could be blue, it could be a million different things, but it will have kind of extension off of that drip. So this is a micro, okay? So this makes the drop smaller for our tiny patients. So regardless of what bag size I have, whether it's big or small, I know what it is based on this area right here, okay? So it's a macro. which I'm already on macro, but I'm gonna show you how to change. We're gonna pretend it's on micro. So, we're gonna have to learn how to change it from macro to micro on here, which is the hardest part, okay? It just takes a little bit of finessing. So, you're gonna start with your machine off, completely off, okay? You are going to press and hold select and turn on. Okay, so it's not a super long on, it's kind of a quick on. If you press and hold on too long, it's not gonna select it. That's kind of like the finicky part of it. But once you hit select, you can select between all 4 of these options. So let's say I want to change it to micro. We have a cat. I'm gonna highlight over the micro. I'm gonna press run. I'm gonna press run again. And then I can set my rate. Okay? So, and then this just goes up by tens, and then you can set your rate. Okay? But I need it now to macro, so I'm gonna change it to macro now. So I'm going to turn off my machine, press hold select, turn on. Okay? So now I'm here again. I'm gonna select through until I highlight over macro, and then I'm gonna press run. I'm gonna press run again. And then it's gonna be ready for me to set my surgical rate, which I forgot to look at.
91,540.
So I'm gonna be 91. So I can push and hold this button, or else you're gonna be here for forever. So 91. I'm gonna select. My volume to be infused was 540. Now this goes by tens, so if my
548.
548, 545, whatever it is, I'm gonna go down. I'm not gonna round up unless directed by one of us, okay? So I'm gonna click 540. I'm gonna select through. Volume infused should always be 0 because I haven't infused anything. So if this is a number of any variety, just press clear, okay, to make it back to 0. So now I'm gonna select through, 91. My time has calculated itself, so I don't do anything with that. My overdose is in, that's at 0, I'm golden. Now I have to save my work because if I just turn it off, it may or may not save it. And then we're gonna have a patient in here and be like, who set this up? They didn't save their work. And then we have to redo it again, okay? So you're gonna press run. This is saying it's running. Obviously it's gonna yell at me because there's no fluid line. I'm gonna press hold. Once it's on hold, I can turn it off, okay? And then now, when we bring our patient in, someone's gonna be carrying the patient, someone's gonna be carrying the fluids, they can put that up, turn it on, put your fluids in, and hit run. And then everything's easy peasy lemon squeezy. Okay, that makes sense? Practice this pump, please. Please. Please.
Please. I beg of you.